Let's review NMES muscle reeducation in your TheraTouch EX4 and CX4 device. In this example, you can use one of three waveforms in your device: asymmetrical biphasic, symmetrical biphasic, or NMES, which stands for neuromuscular stimulation. This treatment approach utilizes NMES to stimulate weak inhibited infraspinatus muscles. In this case, we will target the right side of the patient's infraspinatus muscle for the shoulder. This is based on research by Reinhold et al. In 2008, and they specifically use an asymmetrical biphasic waveform, which is what we'll use in this example today. The mechanism of action is to overcome the neural inhibition in the infraspinatus and activate the weak inhibited fast twitch muscle fibers. Clinical example that we're looking at today is the shoulder impingement syndrome with infraspinatus weakness. And when we talk about and consider what kind of dosing of our intensity, we're looking for a strong submaximal contraction that facilitates external rotation. This is how you set up the protocol for this treatment approach. Select electrotherapy, manual operation, biphasic, asymmetrical biphasic, and then the appropriate channel you'll be using, in this case channel 1. And then we want to make sure we have a frequency of 50 pulses per second, which we do, a phase duration of 200 microseconds, and a cycle time of 6 seconds on and 15 seconds off. We already have the asymmetrical waveform and protocol set up on the device, so I'm simply going to select the amplitude on the screen. I'm going to increase my amplitude, and what you'll notice is that we have the electrodes placed on the muscle belly of the infraspinatus muscle, and I'm going to increase the intensity. I'm going to ask the patient to go ahead and tell me when he feels a tingling sensation. Okay. We're going to keep increasing the intensity now to that submaximal contraction. We also want it to be comfortable and tolerable by the patient as well. So you see a contraction. That's as much as he can tolerate, but we've got a nice contraction of the muscle, and we can start the treatment at that time. And it's going to go through an on-off cycle. Once it does, he's going to actually incorporate an exercise with a light dumbbell. Got an on-off time of 6 seconds on, 15 seconds off. So that's when the on time is on, he'll do an external rotation with a light dumbbell.